Hi, I'm Sanvito. I'm a massage therapist in St. Louis, Missouri, and I'm going to be doing a brief demonstration of continuous flat effleurage as we do it in Russian massage, and also continuous vibration. So the way we do continuous flat effleurage, and the flat refers to that my hand is flat and I'm on a relatively flat surface. I'm going to position myself about at the level of the hips, and I'm going to be facing the opposite shoulder. And I'm going to start with this hand. I'm going to call this my lower hand because as I'm facing the table, it's closer to her feet. This is my upper hand. It's closer to her head. And need a little oil here first. And I'm not going to use too much oil. I want enough oil so that I have a little bit of glide, but there's still just a little bit of friction. So not over much oil. I'm going to position my lower hand so that the heel of my hand is at the base of her spine, medial or lateral to her spine. So I'm going up the muscle group. Heel of my hand is at the base of her spine. My hand is just relaxed. It's just the weight of my hand. My fingers are just slightly spread, just so that they're relaxed. And I'll try to put the pads of my fingers into it a little bit. So my hand is very relaxed, just the weight of my hand, my fingers are pointing to her head, and I'm going to push up. And my pushing is up. It's not down into the body, it's forward. And just as I'm getting to the shoulder and bringing my hand off the shoulder, my upper hand is going to come in, and this hand is going to be, again, on the lateral to the spine's processes, and the fingers are facing towards the spine, so they're perpendicular to my first hand. And again, my hand is just the weight of my hand on her back. The heel of my hand, just because of the curvature of her back, is not making so much contact. The contact is more with my fingers and the palm of my hand. And that hand is just going to be pushing up and come off the shoulder. And just as that hand is leaving, my lower hand is going to come back and push up, so that there is a continuous flow from one hand to the other, so that at no point do I completely break contact. Even though each hand is making and breaking contact, my second hand is coming in just as the first hand is leaving. And in this manner, the body perceives it as a very continuous motion. It's a very unbroken motion. It's very smooth. And it's really a very easy stroke to do. The motion for me is a little bit like swimming. It's very rhythmic. I want a very even rhythm. My pace is moderate. This is kind of a nice tempo. Could be just a little faster. The faster I do it, the deeper is the effect. But for this purpose, we're just going to do it at a moderate pace. And I'll do that on one side for a bit, and then, without skipping a beat, I'll just lean myself slightly forward and do it the same on the other side. And I try to do it equally on one side as the other. So I might spend 15 to 30 seconds on one side and then switch and try to then do the same amount on the other side. And then I'll come back to the original side and do it again. So that is continuous flat effleurage.